Good morning, everybody, and welcome to The Balancing Act. We are so glad you joined us this morning. I'm Julie Moran.
And I'm Olga Villaverdi. Today we'll be talking about improving quality of life when it comes to the very real medical issue of incontinence.
In fact, nearly 3 million Americans suffer from it at some level. And we've got some high-tech solutions for the ones we love.
Plus, psoriasis. It's a condition affecting nearly 5 million American men and women. And in its most severe form, it poses a very serious health problem. We're going to have that story for you.
And The Balancing Act starts right now.
It's a reality we all face, aging. And for a growing number of American seniors, part of that aging progress includes incontinence. As we observe both National Caregivers and Bladder Health Month, joining us to highlight practical solutions for a problem impacting not only seniors, but their caregivers as well, is Philippa Lewis, CEO for Simavita, producers of breakthrough technology, innovative technology, helping to improve the lives of those affected by incontinence. Good morning.
Good morning, Olga.
Thanks for being here.
Pleasure.
Now let's talk about incontinence. When it comes to incontinence, what do seniors and those who care for them experience?
Well, firstly, seniors, they experience a tremendous amount of loss of dignity, loss of power, and as a result of their incontinence, which tends to grow compulsory when you get older, you simply do become incontinent. It's a factor of aging.
Reality?
It's a reality, and I often say to people, you want to grow old, and that's great, but part of aging is certainly some disabilities, one of which is incontinence. When you become incontinent and you're very elderly, it's a very undignified thing. You lose control of your bladder, perhaps your bowel as well, and then you're totally dependent upon your carers. Now, to the carers, of course, it's a tremendous burden for them. To be looking after an elderly person is sometimes joyful in some respects, but the really bad part of it is often the incontinence, because most of your day is really dominated by the care of their incontinence. It's a major, major challenge for care workers, and one of the worst parts of their job, let's say. So this is where we need to look at improvements, if you like.
Absolutely.
Because it's really the most expensive part of the care of that elderly person as well, which a lot of people don't know.
And I love your company's mission statement, and I'm going to read it if I may, and I'm going to quote, "To provide a richer quality of life for older people, improving dignity and grace," end quote. Tell me how your company is making that a reality.
We are dedicated to elderly people having better quality of life. So we focused on one area that really negatively affects their quality of life, and that's their incontinence. So everything about the company and the technology has had that as its focus. That's our core mission, is to improve their care.
And speaking of that technology, you brought a SIM device. Show me how it works and what it is.
I did. So what we've developed at Simavita is the world's first 72-hour assessment for incontinence. So let me explain what that is. Currently, we assess elderly people for their incontinence, but it's a very manual activity, very time-consuming, labour-intensive, and results in bad outcomes. So we've instrumented that 72 hours, and during that 72 hours, our residents or patients, the elderly folk who are suffering from incontinence, wear a smart diaper like this. And attached to that is our SIM pod. So we attach it this way, like so. Easy attachment, and it's worn for 72 hours by the elderly person. And we change it every few hours, of course.
Okay.
But during that time, we're collecting all the information that's going on inside the diaper. That means that at the end of the 72 hours, we have what we call a live bladder chart. That's a completely unique overview of that person's incontinence profile. We pick up every form of leakage, you could say, that occurs inside the diaper.
And that's important information because?
Very important information, because if you understand the pattern of the person's incontinence, you can actually keep them continent for longer. You can take them to the bathroom when they need to go. And so what this clever technology does is it calculates through an algorithm when is the optimal time to take you to the bathroom. That keeps you drier and more continent.
That's what I was going to ask you, because as a result of this, would that individual reach continence faster than, let's say, the individual that just used the traditional pads?
That's a really good question. So what's important about this is At least 25% of elderly people who enter into long-term care facilities in the United States are reasonably continent. Within 30 days, they're very incontinent. And the reason for that is we actually stop assisting them to go to the bathroom at the right time. No one's fault, because without this technology, we don't know. So what happens is, ultimately and very quickly, they will lose their bladder control. Hence, they become highly reliant upon diapers and they become very incontinent. That's the gateway for all these costs to blow out and for the care of that elderly person to become very onerous and difficult and terrible for the elderly person, and even worse for the caregiver who's trying to keep them continent. They have no hope without this sort of technology.
Great information. I want you to stay right there, Philippa, because when we come back, we're going to hear from a healthcare provider offering her unique perspective on incontinence technology as groundbreaking innovations continue to improve lives, restore independence, and offer greater dignity to those affected. The Balancing Act will be right back. Stay right there.
I love SIM for, so many things. One, it provides us an accurate assessment. It allows us to be able collaboratively with residents and families to, establish individual toileting programs. It gives the residents back their dignity. It allows privacy. The staff absolutely love its ability to give accurate assessment. We've now toileting people when they need to be toileted. It allows us then to redeploy staff into, more social activities and, developing relationships. From the other cost point of view, certainly it increases our funding. We're able to validate incontinence, and we're also able to validate a toileting program. The next thing it does, it actually saves us in terms of our continence aids. We were over padding. There was a reliance for staff. It's okay, you have a pad on. Now that's not acceptable. So we're actually assessing people. We're putting them into much lighter, smaller products, which of course brings our costs down.
Welcome back, and we're speaking with Philippa Lewis, CEO of Simavita. Great insight from Karen in Australia.
Yes.
Great information.
She's a great advocate of our technology, and she's a great user of our technology.
Truly making a difference.
Yes.
Now, Simavita is an Australian company. So for people here in the U.S., is this readily available here?
It's absolutely readily available. We have a great partner here in the United States, a company called Medline, and they now have exclusive rights to distribute this product across the United States. So all you have to do is click on Medline and you will get information about the technology and can access it readily.
And let me ask you something, Philippa, on a personal note here. Incontinence, it's not something that I really hear about a lot every day, and I think it's something we really should talk about more, to be honest, because everybody or many people are going to be faced with it. Is the media partially to blame for this lack of awareness?
Look, I think the media probably are partially to blame for it. We need to raise awareness about this situation. I think what people forget is the fact that there's this enormous aging, we call it a tsunami, that's coming through, and people have to think of it that way. It's a huge catastrophe that's coming upon us. Now, when you think about that, at least 70% of everybody who's living in long-term care suffers from an extreme form of incontinence, and that the cost of that incontinence is by far and away the biggest cost of the care of an elderly American in long-term care, then this is something we should all be talking about.
And the caregivers are obviously giving you a lot of feedback too.
Caregivers give us tremendous feedback. It's probably the number one thing they hate to do when they care for an elderly person, yet they do often love their job. And so when a caregiver is transitioned from a manual process that gives them very bad data to something that's really smart like this and gives them fantastic evidence-based information that they can do better care, have better outcomes for their resident, their patient as such, they love it. And it makes a big difference to their workload, their quality of their work, and the quality of their life and the quality of the life of the person that they're looking after.
Great information, great technology. One more time, where can we find it?
Medline. If you go to medline.com, you will find this technology available.
Thank you so much for bringing that awareness.
Pleasure.
I do appreciate it. And of course, if you'd like more information on today's topic or anything else for that matter, just go to our website. That's thebalancingact.com, thebalancingact.com, or log on and share with us your thoughts at Facebook.com/The Balancing Act fans. Psoriasis is a lifelong chronic skin condition that affects nearly 7.5 million Americans. 80% of these patients have chronic plaque psoriasis. Living with and managing plaque psoriasis can be a tremendous burden on one's life. With us this morning to discuss this debilitating disease and what can be done topically to help manage psoriasis is Dr. Rebecca Smith, a board-certified dermatologist in both dermatology and pediatric dermatology. She's also based in Fort Mill, South Carolina, and was voted by Charlotte Magazine as one of the top doctors in the Charlotte metropolitan area. Good morning.
Good morning. Thanks for having me.
Congratulations to you.
Thank you very much.
You must have been so honored.
Absolutely.
Wow. Obviously, you worked very, very hard to earn that.
Yes, ma'am.
Let's talk about psoriasis, more specifically plaque psoriasis. Tell me about this condition and what it is.
Psoriasis is a chronic inflammatory skin disease that often affects, it'll show up on the elbows and the knees. It's pink to red plaques. They're often pretty thick. They have some silvery scale. It can be very visible. It can cause a lot of frustration and a lot of embarrassment to patients. It can actually be anywhere on the body. It can be really flaky on the scalp. It can cover the lower back, the buttocks. It can even affect the nails. So if you have a rash or some sort of skin disease that doesn't go away, consult your dermatologist to make sure that you get the right diagnosis so you can get the right treatment. The National Psoriasis Foundation has categorized different types of psoriasis, and plaque psoriasis is the most common type.
Is it more in males, females, both?
Actually in both.
Really?
Yes, ma'am.
And it's hereditary?
It is hereditary. It's not contagious. It's hereditary and environmental.
So for people who suffer from plaque psoriasis, what are some of the concerns they have to manage this condition? Because obviously there's no cure.
Right. There's no cure. So what we want is we want some education and communication. So the most important thing is to make an appointment with your dermatologist. You need a game plan. You need a disease management strategy. You need to make sure that you get the right treatment for your type of disease. Depending on the extent and severity of your disease, you just may need a topical. But if you have moderate to severe disease, you actually might need a systemic, an oral medication, or some light therapy, some UV light therapy called phototherapy, or you might even need a biologic, an injectable protein to help manage your disease.
So obviously it's not the same for everybody.
Absolutely not the same for everybody. Every case is individual.
Doctor, what are some available treatment options today?
Well, today we're going to focus on topical therapies.
Okay.
And there's lots of different topical therapies. First and foremost, the most common one is a topical steroid. So topical steroids work by decreasing inflammation, by helping with the itch, with the thickness of the plaque. It'll take the redness away. So topical steroids help with inflammation and making the symptoms better. There's creams, there's ointments, there's gels, there's sprays. Many of the patients prefer the spray formulations because often with psoriasis, it's a large body surface area.
And to cover it all?
Yeah, to make it easy, to make it quick, to make it convenient. They want something that's not going to make their clothes messy. So sprays will often rub in and absorb very easily.
Is that what we have here today?
Yes, ma'am.
Let's talk about this.
What we have is Topicort, which is a super potent class 1 topical steroid. It's FDA approved for plaque psoriasis in patients 18 and older.
Okay.
What it does is it decreases the inflammation of the skin, and in the clinical trials, one of the most important points with Topicort is that there was no stinging and burning, even on the excoriated plaques.
Which makes a big difference.
Absolutely.
I know you have an example of a patient, I believe he's 35 years old, and he used it. Tell me what we're seeing here.
Yes, ma'am. So this is a baseline. This patient had psoriasis for 10 years. Oh. This is a baseline photo. And
that looks painful.
It can be very painful, very itchy. So after he's applied it twice a day for 2 weeks, that's the middle photo, and then twice a day for 4 weeks. So you can see it's not cured, but it's significantly better. One of my patients was actually at a swimming pool one time, and he was asked to leave the swimming pool because people there thought he had some contagious disease.
You're kidding. And what about the safety aspect when it comes to applying the spray? Because, you know, I mean, listen, if you tell me it's going to work, I say great, but a lot of people are always concerned. Safety.
The connotation of steroids sometimes is very daunting, but if used as directed by your physician and used for no longer than your physician directs, then they can be quite safe and effective. Topicort is FDA approved age 18 and older for chronic plaque psoriasis. And what you need to do is, again, consult your physician. Make sure that you're on the right medicine for your type of disease.
Are there resources for people out there that may be suffering from plaque psoriasis? Because a lot of people always want to learn more, families even that are suffering through it with their loved ones.
Absolutely. One of my favorite resources is called the National Psoriasis Foundation. It's a nonprofit. You can join it as a patient. You can join it as a provider. They provide lots of information such as pamphlets and booklets. There's lots of information online about various treatment options. And one of the other wonderful resources for medications like Topicort is that there's copay cards So the copay cards make it free for patients who are insured to receive the medication.
And again, huge in terms of making that difference, because from the photo you showed me, again, no cure, but what a difference for that gentleman.
Yes, ma'am.
Excellent. Thank you so much, Doctor.
Thanks for having me.
Congratulations again on the honor. Really proud.
My pleasure.
And of course, if you'd like more information on this topic today or any kind of information on plaque psoriasis, just visit us at thebalancingact.com. That's thebalancingact.com.
Topicor topical spray, 0.25%, is a prescription medicine used to treat plaque psoriasis in adults 18 years of age and older. Topicor topical spray has not been studied in children under 18 years of age. Use in children under 18 is not recommended. Topicor spray should be used for the shortest amount of time needed to treat psoriasis. Tell your doctor if your condition has not improved. You should not use Topicor spray for longer than 4 weeks. When using Topicor spray, you should not bandage, cover, or wrap the treated skin area. Topicor spray can pass through your skin. Too much Topicor spray passing through your skin can affect the function of your adrenal glands. Your doctor may do blood tests to check for adrenal gland problems. Adrenal gland function typically returns to normal after stopping treatment with a corticosteroid. The most common side effects of Topicor spray include dryness, irritation, and itching of skin at the treated site. These are not all the possible side effects of Topicor spray. Tell your doctor if you have any side effects that do not go away.
So much great information on today's show. Be sure to check out our website, thebalancingact.com as well. There's so much there for you.
Lots there. And don't forget about Facebook and Twitter. Look us up and we will see you again very soon. Remember to find your balance.